Thank you, Marie. Well, CTE is a brain disease that results from repeated head trauma and concussions. It's something we often associate with football players, but we're also learning it's affecting athletes in other sports and at a younger age. Joining me this morning are Dr. Mamidi with Healthcare Partners Pediatrics and also Ricardo Laguna.
Buenos dias.
Yes, thank you for coming in again. We saw you, I think, a couple weekends ago, too. Yes, to talk about this very important topic and tips as we head into summer sports season. And Ricardo, this has been in the news lately in terms of Dave Mira. Before his suicide, we're also learning that he had suffered from CTE. Talk about, shed some light on what's happening within this extreme sports industry.
Well, it's kind of wild that Dave Mira used to wear one of the elites of the helmets, and technology's catching up with us. Sad to say, action sports is a fairly new sport for bike safety. I guess that's the best way to explain it, because football, there's a lot of testing, a lot of data for them. For us, this is our first case, and it's kind of mind-blowing for us that he worked the proper equipment to what we think is the proper equipment, and look what's happening.
And doctor, tell us about how, you know, like Ricardo was saying, the light is shed on football, but this is something that affects many other sports as well that people, especially parents, don't really think of associating it with.
That's absolutely true. Football is the leading cause of sports-related concussions, but there are other sports like soccer, baseball, boxing, wrestling, and even gymnastics, cheerleading, and some falls from biking and stuff. And in fact, soccer is the leading cause in female, in girls, actually.
Oh, wow. Okay. You don't really think about that, too.
Right.
I mean, you think anytime you get, like, a concussion or you get hit in the head or you fall on your head, those are warning signs that parents should be looking for. Talk about some other things that they should be looking for.
Yeah. The obvious signs definitely need to be looked at. If you have severe headaches, loss of consciousness, loss of memory, slurring speech, definitely then he or she needs to be taken to the hospital and get imaging studies done. But not everybody has those symptoms. There are subtle symptoms like not feeling right, getting tired easily, changing eating habits, sleeping habits, getting confused, blurred vision, hearing problems. Those are all also important ones. And the most important thing is, even though they could be temporary, they should be seen by a doctor and get cleared before going back to sports.
Just don't push it off.
Yes.
And Ricardo, I mean, you know how hard it is to be an athlete and how hard you train. Talk about kind of the environment in terms of, you know, oh, I hit my head, I'll just be fine. You kind of brush it off, don't you?
Indeed. I just did a contest this Saturday at Craig Ranch, and it's one of the toughest things when someone hits their head and the kid is running so well, but just a little wussy in the whole nine, and he went back out there, but we have to make sure that the medics checked him out and they give him the green light. But for us, when we're out there, we kind of wipe that off our mind to be like, oh my gosh, should we be a little bit more concerned? Our mind just wires to go, let's go back out there and hopefully try to win this contest.
But you have to put your health first, especially helmets as well, because I know you're a big advocate for that.
Of course, of course. But you know, this day sometimes this helmets is not doing what we're doing. We might need a little bit better technology.
All right. Well, thank you so much for your insight to both of you.
Thanks for having us.
All right. The time now is 6:27. It is